Our eyes are like a good camera system, and when we were young, we can actually focus distance and middle and near. But as we get older, we can only focus distance, maybe middle, but for near, we will require reading glasses to see. In general, there are three types of lenses. Basically, a monofocal lens, which allows you to look at distant objects. So this lens gives you the best contrast and also sharpness of image. However, for middle and near, you will need reading glasses to see. The other lens is a multifocal lens or trifocal lens. Basically, it's for distance, middle and near. For these lenses, you will not require reading glasses to read things at near. However, maybe the contrast of the image will be slightly poorer and you may have a glare and halos at night when you're driving. Okay, for the third lens, which is the extended depth of focus lens, or we call it the EDOF lens, basically you can see distance, and also intermediate means that you can see your computer. However, for near vision, like sewing and reading a book, you will need to wear reading glasses. All these three lenses has a toric option, which means that if you have astigmatism, we will need to correct the astigmatism for you to have a sharper image. We can actually put a monofocal with a toric lens, or a multifocal or EDOF lens with a toric component inside. So what should I prepare before the surgery? Firstly, in the morning when you wake up, do consume all your pre-existing medication as per usual and bring the medication slip to the hospital. Don't wear makeup, face lotion or perfume during the day. Wash your hair and your face before you come to the hospital. For local anesthesia, you actually need to just consume some simple meal for breakfast for your local anesthesia. If you have the operation is going to be done under general anesthesia, then you will have to fast the day before, and normally the anesthesiologist will inform you when to fast. Also, please arrange transport to the hospital and back from the hospital, and if you can, get somebody to accompany you so that if you do have some blurry vision after the surgery, somebody can help you. How do I take care of my eyes after the surgery? It is very important to instill the eye drops as prescribed and maintain good hygiene. So immediately after the surgery, don't cook, don't clean your place up, don't do heavy lifting and strain after the surgery. But you can do that maybe about a few days after the surgery. You do need to wear your eye shield when you go to sleep, because we don't want you to accidentally rub your eyes when you're sleeping. When you are at home and you're not doing anything, you don't need to wear any eye shield or any sunglasses. But when you go out, sometimes because of glare, then wearing sunglasses will allow you to be more comfortable and also prevent dust from going into your eyes. When you want to wash your face or wash your hair, just make sure that you close the eyes tightly so that the water don't go inside the eyes. And if you can, when you wash your hair, let the water go backwards. Avoid swimming for the first 2 weeks after the surgery, and do not bend forward excessively. You can watch television and resume most of your daily activities after the surgery. Alright, so if you have any blurring of vision that is affecting your daily activities and you want to get it checked up, feel free to come and visit me in Island Hospital and I can have a good look at your eyes. Thank you, bye!